Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about caffeine in pregnancy. And to make a long story short, everything in moderation, but keep it to a little lower extent. But let's go into the details. So over the years, and like I said, I've been doing this for 30 years, I'm hearing varying information and studies, and it's not clear-cut. Some studies say small links of miscarriage, others say no. Some studies said maybe a association with growth restriction, meaning the baby is not growing as well. Others studies say that's okay. There's the amount of caffeine, and then there's also my personal experience. So what I recommend, which is current ACOG guidelines, but you might need to check the links I provide because it seems to be changing, is to keep the caffeine amount below 200 milligrams. Interesting, the more I look, I hear quite a bit of variation on the content of caffeine in different drinks. Like a cup of coffee is variously quoted as 35 micrograms of caffeine all the way to 135. So I think, milligrams, sorry. I think what you need to do is find out what the content of caffeine is in what you're drinking. Depends on how it's brewed, how it's made. Sodas can be 35, but they can be quite a bit more. Then there are energy drinks that are significantly more. So generally, as it stands now, it's try to stay less than 200 milligrams per day. No one clearly knows the safe amount, but in my experience, those who go significantly higher, I do see links to problems, links to potentially miscarriage, though those extreme amounts aren't healthy for anyone. What do I mean by extreme amounts? Well, I've seen patients who drink 2 liters a bottle of Mountain Dew a day, or 3 or 4 energy drinks a day. The other thing is caffeine is a stimulant that makes you feel like you have energy, but it doesn't actually give you nutritional value, nutritional energy. It doesn't give you glucose or something that you can convert into energy. So if you're skipping meals and taking caffeine, then you can also get dizzy or nauseous or pass out or have your heart racing. It may also interfere with your sleep. So overall, I definitely recommend that you reduce your amount of caffeine. Try to keep it under 200 if you are conceiving. Now, of course, an abrupt change in caffeine, if you're used to a lot, can give you some headaches. So try to taper down and consider a small cup of coffee or soda, maybe 1 or 2 times a day, without, and again, knowing exactly the safe amount. I would really encourage you to stay away from energy drinks. I'm not a big fan of them, whether you're pregnant or not, but I do see more problems in pregnant women with energy drinks. So look at the references, keep up to date. Remember the philosophy of life of everything in moderation. I think a little bit would be okay, but you start drinking some of these hyper concentrated amounts and you could get in trouble. I hope you found this of value. Please leave your comments. Thank you.